Thanks for joining our EDI Messaging Solutions webinar this afternoon. A little past 1 o'clock, so if my panelists and presenters are ready, I would like to get started. I'm Kathy O'Neill. I'm a market manager here at NextGen Healthcare, and our presenters today are Lori Barrett and Chris Klein. We appreciate all of you joining us today, and we are here to talk about messaging solutions, best practices, and how easy it can be to keep up with your patients' communication and scheduling needs. So in case you are wondering, we will be recording today's presentation, and we will be making this available to all attendees following today's session. And we'll be sending this out via email within the next week or so. Following our presentation, we will also be setting aside some time for you to answer any questions you may have. And we request that you type these questions in the Q&A panel, which you'll find at the bottom right hand of your screen. And we will try to address as many questions as we can before we finish today's presentation at 1:30. We, of course, welcome you to connect with us on one of our many social media channels, such as LinkedIn or Twitter. And we do communicate company information on a regular basis, so you'll be able to explore events we're attending, company and industry news, and any other information you might find useful. So for today, the breakdown of our agenda for messaging solutions is as follows. I'll do a brief introduction to introduce you to our presenters and panelists, and then we'll dive right into what is messaging solutions and why it should be relevant to you and your organization. And we'll discuss messaging best practices. We'll go through key items 1 through 10. And we'll also cover, what's ahead and future developments for messaging solutions. We'll discuss some key features such as automated wait lists, pay-by-text balance reminders, and also a multiple patient survey feature. And lastly, we'll conclude today's presentation with a Q&A portion. So a little bit about today's presenters and panelists. We're happy to have Chris Klein and Lori Barrett and Jacqueline French all on the line with us today. And they'll share with you the important benefits of patient messaging and go over best practices and also the future developments and features. And we really hope following our presentation today, you all will have a better grasp and understanding of why messaging should be relevant to you and also how it will support the future success of your organization. So Chris, thank you for being with us today. We're happy to have you on the line. And a little bit about Chris Klein. She's been a NextGen EDI product manager with us for over 5 years now. And Chris has over 40 years experience working in the healthcare industry. Lori Barrett is a senior operations manager for EDI. And Lori has been with us for a little over 2 years right now. She's based out of Irvine, California. And Lori has been in healthcare operations for over 15 years. And Lori is truly passionate about continuing to expand our EDI solutions team here. And we appreciate Lori being with us today. And lastly, we're happy to have Jacqueline French with us as well. Jacqueline is team lead for EDI and a systems analyst. And Jacqueline works directly with many of our EDI clients, and she'll be able to answer any questions you may have following today's presentation. So at this time, Chris, I'd like to turn the presentation over to you. And thank you again for being with us today. And Chris will give you a brief overview on our messaging solutions and why this should matter to you and your organization.
Thanks, Kathy, and thanks for putting this on and hosting it and inviting all of our clients and making it possible for us to share the information that we are right now. I don't think you've given me the ball.
One moment, please. Let me pass this over to you.
It's the globe. I need the world. Okay, there we go. We have the world at my feet.
All right.
Now. So,
there you go, Chris.
As Kathy was saying, we want to start out by making sure that we set you up for success and that, you understand what is messaging because, the key word here is really integrated. And that integration means a lot. And so with EDI messaging, it's really designed with our clients. It's been a growing solution, but it's been built by NextGen developers and everybody else who works to make this possible, but we're doing it within our client's workflow, so within your workflow. And that's really important. We see a lot of products out there, and you probably see them too, and they look cool, they demo really well, but you have to kind of change what you're doing and work in their workflow instead of the solution coming to you and working within NextGen and working within the way you are going to be efficient and successful. So that's really one of the biggest things. But it is really beyond appointment reminders now, and it's really targeting the right patient to deliver the right message in the right way, in the way that the patient wants to be communicated with. That really brings us to the better ways of communicating with our patients, and they and really it increases that quality of care because they know that you care about them because they have that information in the way that they want to receive it. So why is messaging solutions, EDI messaging solutions, important to your organization? It covers the gamut of appointment scheduling as well as balance reminders, so that revenue side of things also. And then how are you doing? Are listening to your patients for their feedback. And so to sum up what we have available right now, I'm not going to read off the entire slide because I know you guys could read, and I always, whenever anyone reads slides, I always go, okay, I'm bored now. And that's the last thing we want to do because these solutions are really, really exciting. And for us, to be able to offer these and by the request of our clients, and we'll get to those at the end. We're going to talk about some of our client success stories. So as we look at scheduling management and patient loyalty, these are just different solutions that we have available right now. And if you're currently an appointment reminders, client, or voice reminders, or whatever you call it in the past, we've relabeled and revamped it to be messaging solutions. And we've offered best practices and new solutions that can be added on. So all you have to do is open up a Success Community ticket or case and get some of these new things that you're learning about that are available right now added on to your services. And if not, we'll have contact information at the end of how to maybe get a demo or learn more about it if this just kind of teases you and touches some of the stuff that you see that are needs in your practices. We'd really like to be able to take it to the next level and talk more about it. We could talk on forever. So besides looking at what NextGen and our clients' needs are, that's very, very important. But we also want to look at what the industry is and healthcare as a whole and where research has been done. And so these are research studies that have been done in the last year. And it's an ever-changing market. I mean, people and their smartphones are, it's increasing. My 86-year-old mother has a cell phone that gets texts and so forth, and I think everybody has stories like that. There are different needs for different types of your community, of your patients, but the success of being able to reach your patients and communicate with your patients in the way that they want to. So that preferred method of contact is very important in the rise of the different variety of ways of contacting. And that really brings back to the cost savings. So in this Kaiser Permanente study, showing that with, decreasing those no-shows, and Lori's going to get into that as best practices, how much cost savings that can provide to you, and that's bottom line dollars. So at this point, I'm going to pass it over to Lori so that we can cover those best practices, and take it away.
Thank you. And again, thank everyone for attending today. We're always very excited to be able to talk a little bit about this service. Basically, what we wanted to put together is a team that Jacqueline leads. They work very closely with all of our clients that implement these services and on an ongoing basis. And over the years, we've really learned some of the success stories of our clients in this service, and that's what we wanted to put together for today. So we're just going to go through some of those. We made a top 10 list. And, the first is the core service that we're offering, which is appointment reminders. Automated appointment reminders that obviously will save and reduce staff productivity. It's very efficient because, one of the core values that we have on any EDI services that we offer is that it's integrated into our software. Not just that, but integrated into the workflow that works for our clients. So what we have is we're able to implement appointment reminders based on what type of preferred method, if you want to follow that for the patient. We can deliver them via phone, text, or email. In addition, we are able to craft the script for those appointment reminders based on appointment type, providers, location. The customizations are almost limitless. We, of course, within our appointment reminders, we have any language you could basically think of that we're able to craft as well, including some, just to give one example, including instructions for a particular appointment, letting that patient know perhaps to bring certain things to the appointment, or if there's an address change, a recent suite number change, anything like that, we're able to really take those instructions and important details for the patient and deliver them in such a way that the patient has the information they need prior to the appointment, and it also reduces any questions they might have. That's another area we've really improved upon in the last year or two. So the benefits are, again, we've majorly focused on proving a reduced no-show rate, which does translate into increased revenue for obvious reasons. The staff productivity, able to not really focus on these types of tasks. And there's no equipment to install. We know some of our clients that are coming from other solutions, they actually had to install things. This is fully integrated into your NextGen software. Much of this I covered on the previous slide, but just to touch upon a couple other things. It is automated where there's an automatic upload of the appointments nightly. Once our implementation analysts, they do the implementation and it gets automated. They also will ask, do you want to follow the patient preference? Or we can also follow if there's different types of preferences that you wish to do based on your patient population. Within the message, it's very important, obviously, to ask the patient if they're able to confirm that they're coming. If they want to reschedule, they can indicate that they're going to reschedule, or they can transfer directly to the office, which is a feature many of our clients like, because then you're getting that appointment rescheduled right then and there. There are results that do post back, again, integrated into the software that indicate that the appointment, what the patient did indicate if they selected confirmed or canceled. It details out what type of response that the patient had, and there is tasking available as well. And what I mean by that is if a patient maybe had a wrong number or we could not deliver the message, that many of our clients will task based on that and let the patient know, they'll reach out to them a different way to update their information. The implementation that we do, everything that we do to support the clients on an ongoing basis is at no additional cost. There's no training fees or implementation fees associated with that service. No-show appointments immediately. This is the best practice we've really seen promoted with our clients. And what occurs is, you have patients all the time that they've committed to coming, but then they don't show up. And what we've built is a service that we can recognize those patients that do not keep the appointment, and then we've built messaging that can go out to those patients, and it's a friendly message, telling the patient that, we're sorry we missed you, we want to get you scheduled, your care is important to us. That message goes out. Again, this is all automated with the same customizations that I mentioned earlier. We deliver the message via voice, text, or email the day after the appointment is missed. Many of our client base, they do utilize what we call the hot swap feature, where the patient can be transferred back to the scheduling desk as they get the message. They just press to transfer. And this has really helped drive new appointments for our clients. This is, something that, a statistic that we have showing the no-shows does translate to lost revenue annually. And, when we first started offering our appointment reminders a few years ago, we did prove to our clients in each, client appointment type is different, that they are saving revenue by offering appointment reminders. And now we're seeing further cost savings for clients that implemented the no-show message to get appointments scheduled quicker through an automated method. The third best practice that we recently rolled out, which we're very excited about, is the ability to send balance reminders. Truly we have cost as part of the conversation many times with patients, and it's nice to be able to automate that conversation, even if it's just to notify a patient who's coming up for a new office visit or maybe a follow-up, and it's a friendly reminder letting them know that they do have a balance, and that's basically what it is. The configurations there are very much based on, how many statements maybe went out. I will point out this is pre-collections. This is not a collections call by any means. Many of our patients that are getting these messages right now, they're getting them between about 30 and 45 days, so there's no collections involved, but they do have an upcoming appointment, and it makes cost part of that conversation. This is really an exciting service that we launched because we know at the other end of our messages are patients. And I really, we all get a little bit excited about this one because it's building patient loyalty. It's really about the patient here. What this is the ability that if you had an appointment where you're expecting a patient to come in, but the provider or the office or something happened and that appointment's going to be running late, that it allows you to go and seamlessly, the patient's name is there, you can click, the messages are all pre-recorded by our implementation team with your approval, and that message will be delivered to that patient within about 5 to 7 minutes, indicating to them, we look forward to seeing you, your appointment is running 30 minutes behind or 45 minutes behind or whatever the circumstances. Truly, we hear from our clients as well as, we all have patients in our lives, whether it's friends or family, that this is a service that do you feel cared about as a patient? That the fact that they're willing to let you know how valuable your time is, that you don't have to sit there. We all have so many errands, maybe we could run in between or not leave the house, earlier than we have to. So this really is focused on building patient loyalty. This one, we built an ability for inclement weather notifications to go out. This service has been used for things I could never have imagined that it's used for. It was originally intended for inclement weather, but we've had clients utilize it for power outages, water main breaks, road construction, or just emergency patient communication, basically. What we've built is part of your service, you will have access to a portal 24/7 that in the event of having to cancel a certain patient or a certain time slot, certain providers, you are able to log in with a secured login, your patient list based on the selections that you do, the dates of the appointment, who the provider is it all providers, and what appointment timeframes do you wish to cancel. And again, within about 5 to 7 minutes, those notifications, they do go out to the patients. All of those results, just like normal, will be integrated back into the software. We have seen that, this was something that we built in collaboration with clients. We actually had some core clients review what we put together, understanding the needs that they have. And, right now you can't really watch the news without seeing we have clients all over the country that utilize it for different time frames. Many times when our clients are utilizing this service, they're not in the office. They're doing all of this from their home at 4 in the morning because of a snowstorm or something like that. Another best practice, and this is similar to, provider running late a bit, but we also heard that, sometimes we'll have a cancellation and we can have a provider that has an open slot and the patient can actually come in earlier than the schedule normally had allowed. And this is another way to build patient loyalty and offer a patient to maybe come in a little earlier. I know for me, if I have appointment and I'm leaving work and I can finish that appointment even a half hour earlier, that's a half hour more that I get of my day, and it's been appreciated. Another area a functionality that we built to try to, decrease no-shows even more is as the patient is getting the appointment reminder, they have the ability to save the information to their calendar by clicking a link within the reminder. It seems simple maybe if you utilize your calendar and you're very, very organized, but there's tons of patients out there. I would say I'm actually one of them, that this is a further ability for me as a patient to get it into my calendar just with a click and further remind myself as I'm utilizing my own calendar that, oh, I do have that appointment coming up. Basically, what we were really diving into now is how are we going to assist our clients with patient feedback. It's not just about having the appointment, but, there's a lot of different changes in the healthcare industry that having a dialogue with your patients after they have seen you and your provider, what was their experience like? And one of the best practices we have right now is a one-question survey that goes out after the patient keeps the appointment. Again, it's available voice, text, or email. We definitely are seeing a lot more results with text at this time and email. But what we do is we're able to craft the survey based on, again, what do you want to ask your patient, the look and feel of the message, especially with smartphones. We're able to customize the survey to have your logo, the color scheme that you have within your logo, so you feel comfortable that the survey that is being delivered from your organization truly represents what what you represent to your patients, you know, as you're giving them other types of information while they're there. It's very simple. It's a one-question survey, and the patient is able to click or press indicating, rating, whatever rating of the question that you'd like. Again, everything that we do flows back into the software, and we do have reporting that you can task. If a patient, for instance, the survey we're looking at is on up to a 10 scale, if you said, I want to understand a bit more about patients that rate us a 7 or below, tasking becomes available for that. You know, one of the best practices I alluded to earlier is just, creating that personal outreach. We have one of the things, birthday messages, just being delivered. We can do different things within that. You know, we can make it a fun video with your office staff, just something to remind the patient that you're thinking about them, not just thinking about them when they're having an appointment scheduled. So there's different features that we can do as we work with the different organizations that we represent. We really try to understand, you know, what do you see as increasing patient satisfaction for your organization specifically? Another piece that we really truly try to focus on is just education of patients and the communication that we're doing with them. So, you know, just to kind of overview some of the things that we talked about, how we're able to do that. The communicate better with patients. Again, when we're implementing any of the, we might ask, for this appointment type, are there instructions that you want to communicate, or are there, what's the most common reason this type of patient calls into you to ask a question? Could we fit that into the script where it flows well? Missed or forgotten appointments, we went over the importance of that, the patient balances, and really just knowing that as we move forward as an EDI service within NextGen, we're continuing to move forward with new services that we're hearing are the needs of our clients. Just to highlight a few of the services we're currently working on, one of them is the automated wait list. We do know there is an automated wait list available in NextGen right now, but we truly want to take that and integrate it within an EDI service, so as these appointments open up and there is a patient on the wait list, that there's really nothing that the office staff needs to do. That patient will be matched with the upcoming canceled appointment, a message will go out, and again, if the patient does accept that appointment, it will do many things, including, update that appointment with that patient, indicate that in a report, and so that's something that we've been working on, and we want to make sure that it's well received and going to work within the workflow. So we had several focus groups regarding that. We'll look forward in the future to releasing that with, asking for some beta clients. The next phase of our balance reminder message that I mentioned earlier is not this the ability to deliver the balance reminder to the patient, but also to give them the ability to click to pay. So that's something that we're very excited about. And the last feature, which we're currently have a couple beta clients that Jacqueline French is working with, is multiple question survey. So again, this would be delivered in two methods, either text or email. The surveys are created with our clients, and they do have the ability to have dashboards that are set up by our implementation teams to really dig into a bit more than the one question survey. In lieu of time, I know Cassie will be sending this out, but this is just the details I gave about the upcoming services. And then lastly, we just want to share that, our implementation team truly becomes partners with the clients that they implement. And, you know, we have some success stories for some clients that they implemented the service thinking they were just automating appointment reminders, and it became so much more than that. And that's what we really pride ourselves on. Specifically with Wilmington Health, you know, they've been a client of ours for a few years now, and we continue to partner with them on new needs that they see that could add value to their organization, and we can further automate. So with Wilmington Health, and this is, you know, I think standard, the first few anyway of our clients that we've implemented, the decrease in no-show rate, patients arriving early. I guess I failed to mention that some of our messaging, we can indicate for specific patient types, appointment types, or just specific to what needs you have, that we can indicate in there the time to arrive being 10, 15 minutes earlier than the appointment time. And that obviously translates to the flow working better in the day-to-day office. I know where Wilmington is, they actually utilize that inclement weather portal quite often. They were very satisfied with what we came up with. And then, you know, they always have different changes in providers moving to new locations and things like that. So I know that was a lot of information in a short amount of time, but with that said, you know, I know I'm going to turn it back over to Kathy, and if there's any questions or anything else, we're happy to answer them now or at a later time. So Kathy, hopefully I turned it back over to you.
You did, Lori, and thank you so much. I just wanted to give everyone a friendly reminder. We do have some upcoming webinars you may be interested in. Next Wednesday, August 24th, we will be hosting the power of patient engagement and the tools you need to be successful. And so we'll share with you some other offerings we have to support patient engagement and population health. And, you know, messaging solutions is just one of those many solutions that we have available to you. And this is also just the path that you can sign up for future webinars as well that we will be hosting. So at this time, I know we're a little past 1:30. I would like to just answer a few questions that have come in during our presentation. And Lori, Chris, and Jacqueline, please just chime in as you see fit, and I'll just dive right into these so we can address some of these things. The first question that came in, do we have to do any daily maintenance or setup of the messaging files to submit to NextGen?
Jacqueline, can you take that, please?
So there is no maintenance. Once we install and implement the messaging services, we do set it to automated. Our team also has audits in place, so once you go live, our team fully audits it on a daily basis to ensure that your file is received. And if not, we reach out to your IT, we pull the file so there's no delay in processing that, and then also researching the root cause with your IT contact.
Thanks very much, Jacqueline. Moving on, the second question, can you accommodate by practice specialty?
Yes, so message, scripts, and contact times can be configured per practice, so either service location or event type, but we can drill it down to also the resource as well.
All right, great. Thank you very much. I'll do two more questions here. The question number 3, what if my file is not transferred successfully? How will I know it?
So I kind of touched on number 1 on that, but basically if the file is not received, our team audits it on a daily basis, which reports to us if your file is, has not been transferred successfully. We will then reach out to pull that manually and then research the root cause so we can re-automate the process.
the last question here, how is this messaging console supported during implementation and also after we are live?
So during implementation, our analysts work with you very closely to not only build out those messages so that it's per your organization's preference, but then afterwards, when you're adding new locations, if you have any questions to add new locations or resources or event types or updating scripts, it's as simple as opening a case in the Success community, and our team works closely with that. We do implementations and support, so it's just a full cycle within our analysts on the messaging solutions team.
Thanks very much for that explanation, Jacqueline. And I did advance to our contact slide, so if we do have additional questions or if we haven't been able to address some other questions that came in, please feel free to reach out to both Lori Barrett and Chris Klein. I have their contact information there. And you can always reach out to me as well. My email address is KONEILL@nextgen.com. And this does conclude today's presentation. I'd like to thank all of our attendees for joining, and a special thanks to our presenters and panelists, Chris, Lori, and Jacqueline. I truly appreciate your contributions and participation. And please, feel free to reach out to our team if you have questions or if you're interested in a messaging solutions demo in the near future. We'd love to assist you, and we appreciate your interest. Thanks very much, everyone, and have a wonderful afternoon.
Thank you. Have a good day.
Thank you.